I've heard from our patients where previously before coming to Heuro, I feel like I'm bothering my doctor. And it's very difficult to call your doctor office and even get someone to answer the phone because they're busy prior authing and doing all this stuff with the insurance. But we flipped the switch.
Welcome to The Orange Tea, where we explore thought leadership on performance and wellness to insights on modern healthcare. This episode features Jeff Bernhard, president of Heuro Health, and Dr. Tom Walsh, clinical director at Heuro Health. Together with the host Stephen M. Perry, they are tackling one of the most urgent and costly healthcare challenges in America: obesity, type 2 diabetes, and the expanding demand for GLP-1 medications.
So I think, to me, accessibility is so important. That's just not an accessible way to treat your condition. No. But I feel like the Heuro Health, you guys have built in accessibility as a mantra. Is that accurate?
Absolutely. It's just the virtual nature of the offering. You don't have to come into a brick and mortar practice. We come to you via apps and iPhones and tablets, whatever it may be. And flexible scheduling, et cetera, but having frequent touch points. I mean, on average, 2.5 times a week, we're having some communication with the patient, mainly via the app that we give them, just little questions to answer, little tasks to do, simple stuff just to know, hey, they're there, they're engaged, and kind of see if there are any red flags out there.
And I want to reiterate that ours is a virtual, but we are able to do a hybrid with an on-site clinic with a primary doctor. There's a time and a place to see a doctor in person. Don't get us wrong, but to treat this condition effectively, treat the cause, it would be hard for someone to do 20 visits a year. That's a lot of time off work, a lot of driving to the office. So we meet them where they are, so they don't have to move to a farm in Ireland.
Yeah, I know I'm relatively healthy. I have a hard time just making my annual physical. Make that appointment, make sure I'm actually not traveling internationally and just in town for that. And I'm perfectly healthy, knock on wood. Let's talk about bariatric care. I think those surgeries for bariatric surgeries are down. They still obviously have a role in the healthcare system. Do you guys interface with bariatric care in any way? And what's your view on that?
The answer is, of course, yes. Bariatric care encompasses medical and surgical approaches and pulling in the dietitians and the behavioral health specialists, et cetera. And then there's bariatric surgery, bariatric surgeons. And by and large, they're going to focus, focus on making sure a patient is a good surgical candidate, that they're well educated going in, and you do a good operation and good follow-up care afterwards. We have to integrate with them. We have to interact with them. About 5% of all folks, despite our best efforts, are just not going to lose the weight they really need to lose and be candidates for bariatric surgery. For instance, just say you're starting out at 600 pounds and work with Heuro and go through the Heuro journey, and we help them lose 200 pounds. You're still 400 pounds. There's still that extra distance to go. And we would often, in my old practice, and we do this within Heuro, is have a vetted, good quality bariatric surgical program to which we can hand the patient off and get that remaining weight off and get them healthier sustainably.
It's my understanding you can't put a 400-pound person on an operating table for bariatric surgery. Is that correct?
Well,
it gets quite dangerous.
But it's riskier.
Okay.
It's riskier. It is done,
okay.
And it is not optimal for the surgeon physically doing the operation or for the patient undergoing it.
Okay. I think one of the things I read about a lot, and I've done a lot of what we call primary research. So primary research is actually interviewing the person on the GLP-1, on that weight loss journey, on this journey to solve these other medical conditions that they're facing. And it's been eye-opening. If you do not believe this is a miracle drug, I mean, you're not talking to the patients. We're talking about improved sleep. I would argue sleep is the foundation of wellness. If you're not sleeping well, nothing's going to go well.
Nothing's happening.
For women that are hormones are in and out of different situations, it stabilized their hormones. Those are just unexpected side effects. Someone trying to quit smoking, hopped on a GLP-1, was able finally to quit smoking. There's so many of these success stories. However, I think there's the dark side of it, which is some of these side effects. So can we talk about the side effects of GLP-1s, why that scares people off, and then what does the Heuro journey do to get people to stay on the program so that they can ultimately achieve their end goal?
So again, we're not a GLP-1 company pushing these medicines, but they are wonderful drugs. They have a lot of benefits, some of which are gradually just becoming known, helping with cardiovascular disease, decreasing the rate of heart attacks and strokes, helping people with poor kidney function that are overweight, helping their kidney function to get better. I mean, a lot of side benefits, the addiction issues you mentioned. And the problem is that when you start out, if you're not really getting the advice and being treated by an expert that uses these medicines day in and day out, you can be started on too high of a dose. You can be kept on too low of a dose too long, both of which are bad. Too high of a dose, you're getting side effects. Nausea, really common. Diarrhea occurs. Some people, on the other hand, become constipated. The very, very rare side effect of pancreatitis. Honestly, didn't see that a whole lot in our practice, but it certainly can occur. We were just talking to a physician yesterday in a clinic down in Florida that was sort of dealing with some pancreatitis cases in their population. Primarily, it has to do with ramping up the dose too quickly, not having a good plan where you're interacting with the patient real frequently and ramping up the dose at a proper pace.
And how many of the side effects are just like, hey, tough it out, this is part of the
they can be treated.
Part of the program. I think heartburn was maybe one of them I saw kind of pop up. So how much of it is just kind of coaching to stay on so they can actually get their body, make that adjustment? I would imagine this is a major adjustment for your body.
It really is, because it's a natural, it's an agonist, an analog, a laboratory created version of a hormone we have in our body. But it's just designed to act longer, so like a once a week shot as opposed to needing to continuously take it. So a lot of it is just simply one, education, making sure a patient knows what to anticipate and let you know about it. That's where the asynchronous communication comes in very handy. Backing off on the dose a little bit, or let's hold it next week and start back in. There are just little tricks you can do, certain foods to stay away from, and also we do frequently prescribe an anti-nausea medicine to have available in case you have a mild episode and you're going out to dinner or you're going to church or whatever it may be. Take that before you go.
Is this just for the patients, or is this also for the healthcare providers? Can you talk a little bit to that?
So that's another favorite topic of mine we talk about all the time, and that is I think really doctors are being, the proper term is, but put upon, taken advantage of, not being treated well in our present healthcare system. The documentation issues are killing, but the physicians hate electronic medical records, on and on. And so I think Heuro not only needs to be a very good steward for the patients getting great results, we need to take good care of the physicians too. One, so they want to work with us, but the other is just to create a more desirable environment for a physician to work in, and for dietitians, anyone has to do all the documentation stuff.
Yeah, and I would add to that in that what we hear from primary care offices, FQHCs, is that we're not equipped to deal with someone with an intensive journey like yours. We're not equipped to do 20 visits a year. We don't have a dietitian. We don't have a neuroplasticity coach. And, we see multiple issues. We're a primary care office. We have 5 to 10 minutes with the patient. We don't have a half hour. So I think it's difficult for them to admit they're not able to do it. But the ones that we've run across say, look, we'd love for you to be adjunct to what we do. And we will always refer patients back into them, work through the EMR and so forth. But most are finding out and admitting that to get success for their patients, which means remission of diabetes or weight loss, it's very intensive, and the system is not built that way currently.
Yeah. For self-funded employers, so Kymanox is making this transition. We have 300 employees worldwide, and we're going to go from
insured
to self-funded with reinsurance. What problem can you solve for people who are deciding to self-fund their insurance?
Yeah, so we do this every day. So the first thing that we do is we sit down with them, we get their data. So the easiest thing to do to start with is to find out who are the type 2 diabetics taking GLP-1 medications. We de-identify them, and out of 300, you may have 20. Depending on the demographic of the population, we go with the self-funded plan sponsor and we say, look, our goal is to get that patient healthy, reduce the claims by 75%, and get them on a better path to life. They say, where do we start? So what we actually do is we build our journey with your TPA, and the TPA pays us a per patient per month basis. I want to reiterate, we are a provider group. We're not really a point solution. We find out what states they're located, and we get to work. And if you think about my previous statement, if the average diabetic spends $21,000 to $23,000 a year on care, that's what the plan sponsor pays. We're just taking $200 of it. That's it. So we're really shifting from the traditional system to a capitated, highly efficient system, but every day, twice on Sunday, the outcomes will be significantly better, and it's very focused and concentrated, and that's how we do it.
Yeah, and type 2 diabetes is reversible. I had a friend, he basically quit his job, moved to a farm in Ireland, and became a farmhand. And this is a very seasoned, life science engineer, and literally within a year, he dropped weight. He had developed new habits.
It's amazing, isn't it?
Eating all whole foods, and his type 2 diabetes went completely away. And then that was about 5-6 years ago, and it's never come back.
He didn't come back.
And well, he's still. I think he's off the farm now because I think the farm life was enough for him. But he's he's beat that disease completely, and it was just purely with a lifestyle change.
I would say what's interesting as we approach plan sponsors, self-funded employers, that's what we call them. Most of them don't think it's possible, right,
Nope.
doctor? So they don't think it's possible. But when we talk to endocrinologists and the folks who know, it's entirely possible. Now, is it possible for every person? No. Our goal is to get 60%, but we use the term remission versus reversal. But he successfully, Dr. Walsh has done it successfully for many, many years. So it can be done, but for whatever reason, it's not top of mind for employers.
So I think one of the things I was hearing from people on the journey with Heuro, your company in particular, is that maybe they're experiencing the side effects, but they're staying on the program.
Yeah.
And it sounds like this high touch environment where they're getting a lot of their questions answered in real time. We talked about 20 office visits a year, which is just incredible. Is that part of the secret sauce to manage these side effects and get people to the other side?
Yeah, absolutely. Look, I think that our traditional healthcare system, there's major issues, which is a whole nother podcast. There's access issues. Doctors are burning out. Patients aren't necessarily getting the treatment they need. There's also like a psychological effect where I've heard from our patients where previously before coming to Heuro, I feel like I'm bothering my doctor. And it's very difficult to call your doctor office and even get someone to answer the phone because they're busy prior authing and doing all this stuff with the insurance. But we flip the switch. What we do is we call them. We have a doctor call them. We have a nurse call them. And that's a different dynamic. And it kind of relaxes the patient. And we put our arms around them, virtually hug them and say, this is what you need to do to deal with that side effect. Most of these things are treatable with over-the-counter type medications. But just knowing someone is listening and caring and paying attention is more than half the battle. And that's very difficult to do in our traditional healthcare system.
I would imagine just a traditional doctor, you mentioned the little dose titration. So start slow, but don't stay on a low dose for too long, right? Mm-hmm. And that you're kind of messing with that dose at a pretty high frequency, and that requires a lot of interaction with the doctor. Yep. I just don't think a traditional doctor's office can even handle that.
It's difficult too. I mean, you mentioned co-pays and deductibles. And every time you walk in, it's another $50 or something out of your pocket. Time off from work, you got to drive to the office. Maybe they're run behind you. And it's just logistically, it doesn't work very well.
Great. All right. Any parting words for our audience? Just something about Heuro Health that they may not know, or something about obesity that they may not know. Jeff, do you want to get us started?
Yeah, so I'd say two things. I think that Heuro Health is, our mission is to really give people their lives back, their health back, to lose the weight, to change the mindset, and to get on a healthier path. And we've built this company with people like myself that have been on the payer side for 30 plus years. Dr. Walsh, I won't date him, but over 30 years in the medical field. But It's interesting when you have two people who are supposed to be at odds with each other, the payers and the providers, joining hands and say, let's do this. Like, I know the issues on the payer side. I've never operated on a patient. He has done successfully, got people in remission. And that's what makes it special. And I think when we have the opportunity, a few weeks ago, we went to a customer and one of the patients asked to talk to us. And that's when it really gets great. And when the patient says, look, I'm 4 months into it, 5 months, and I'm down 70 pounds. And guess what? I can walk again. I don't have my lung issue. Yeah. I don't have my MSK issue. And I feel pretty again. That is really cool.
Smile on her face.
Smile on her face. We put people in the position with, again, holding them accountable, holding by the hand, to get their lives back. And what a great thing to do. What a great thing to get out of bed every morning and say, I'm giving people their life back. What I would just say to employers is think about this. This is not going to get better on its own. You got to protect your employees and their dependents. It's your best asset you have. And whether it's Heuro Health or whether it's someone else you go, get a companion program to wrap around that medication will make all the difference in the people's lives and, quite frankly, in your financials as well.
Agreed. One of the main tenets when my partner and I put together our exclusively bariatric clinic about 15 years ago was that we really believed that the pill wasn't the answer. The shot wasn't the answer. Even the operations we were doing weren't the answer. It was having that period of time when the mind quieted down and the person was feeling better, wasn't hungry all the time, and they could make change. And to help them make those changes so that it became sustainable. They could check back in every once in a while. We actually asked them to check back in every once in a while with us forever. And this is a lifelong journey and worked out very successfully.
Yeah, I think the United States healthcare system is broken, but there are these bright spots like Heuro Health that are literally fixing it. So please have optimism. Please support these companies that are literally changing the way we're going to make ourselves healthy again. So thank you for joining us. Much appreciated. See you next time.
Thanks again to Jeff Bernhard and Dr. Tom Walsh for joining us. The challenges surrounding obesity, type 2 diabetes, and the increase in GLP-1 costs aren't going away. But today's conversation shows that sustainable, scalable solutions rooted in whole person care do exist. Whether you're an employer, provider, or patient looking for a better way forward, Heuro Health's model is one to watch and one to learn from. If you enjoyed this episode, don't forget to check the show notes for more resources, including our full interview with Heuro Health founder and CEO, Jesse Kessler. Subscribe for more conversations like this, where we explore how to build high-performing teams, drive lasting impact, and think holistically like a T-shaped professional. Until next time, thanks for listening to The Orange Tea.